Namaskar. Myself Professor Dr. Narayan Shahane, Consulting Ayurvedic Urologist, Medical Director, Brahma Ayurveda Multi-Speciality Hospital Research and Academic Center, which is world's first and only Ayurvedic Urology Center. Dear friends, in this video, we are going to discuss regarding Uttarbasti treatment, which is proving to be the most promising treatment for the urethral stricture disease. So first of all, in this video, we'll watch how we perform the Uttarbasti. Obviously, Uttarbasti is conducted under very rigid aseptic precaution in a specially prepared urological operation theatre. Now, in this, it's very important that there's no need to introduce a tube or a catheter for the purpose of Uttarbasti. The medicine is introduced using that small adapter. In this, the medicine is introduced into the bladder. Generally, we introduce 60 ml of the medicine, either an oil-based medicine or a water-based medicine is introduced. It is introduced very slowly and gently, and the best part is this particular treatment is absolutely painless. We have treated patients of age ranging from 5 years to 96 years within last 22 years. And to be honest, nobody ever experienced pain. Yes, a little discomfort is very obvious, as urethra is supposed to be the most egoistic part and most sensitive part of human body, and we are introducing something against the natural passage of it. So a little discomfort is felt, but it is manageable, it's not painful at all, the most important part. Yes, the medicine is introduced very gradually, the whole medicine goes to the bladder and from there it works. Obviously, the procedure is conducted under very rigid aseptic precautions. Wherever possible, we use disposables. Then even the medicine is properly sterilized, so the chances of infection is totally completely ruled out. So this is very important. So this is the procedure of Uttarbasti, which is again absolutely painless. Now, how this particular treatment works on urethral stricture disease. In our last video, we have discussed regarding the actual pathology, the process of disease of urethral stricture, how it occurs and why it recurs after conventional urological treatments. Now, in this video, we will discuss regarding how it can be cured with this particular treatment of Uttarbasti. So, the way we do Uttarbasti for urethral stricture patients, it is a course of 20 sittings. Now, the medicine used during initial 5 sittings, the main purpose of that medicine is to make this spongiofibrosis, this particular spongiofibrosis soft. That's the main purpose. At the same time, this fibrosis is removed layer by layer by dissolving in the medicine, but mainly it is turned soft. Now, it's not only that we need to make it soft, at the same time we need to restore the caliber of urethra. So, for that, from 6th day onwards, we start the process of calibration. Now, in this, on 6th day, we introduce different catheters, Nilatan catheters, disposable catheters. Now, obviously, the medicines from 6th day change. The main purpose of medicines used during initial 5 sittings is to make that spongiofibrosis soft. But the way we learnt in our previous video that urethral stricture is a kind of non-healing ulcer, and in Ayurveda we have specific medicines to address such kind of non-healing ulcers. Those medicines, they clean the wound and at the same time they help to heal the wound as well. So such medicines are added to the initial set of medicines from 6th day onwards. So on 6th day, initially we introduce an anesthetic gel into the urethra, followed by we introduce the Uttarbasti medicine, means we do perform Uttarbasti, and followed by on 6th day we introduce 10 and 12 French catheters. These are Nilatan catheters. 10 is very small, and that too we introduce it very gently, very slowly, without forcing it in. So obviously, the way this medicine makes the fibrosis soft, then the entry of these catheters is very easier, very smooth. This is again painless. So we introduce a 10 French catheter, we keep it there for some time, then we remove it and throw it. Then we introduce a 12 French catheter, we keep it there for some time, we remove and throw it. On 7th day only Uttarbasti. On 8th day we do introduce again, initially we introduce some anesthetic gel followed by Uttarbasti medicine, and here we introduce 12 and 14 French catheter. So, we gradually increase the size of the catheter. On 9th day only Uttarbasti, on 10th day we introduce 14 and 16 French catheter. On 11th day only Uttarbasti, and on 12th day we introduce 16, 18 and 20 French catheter. Now 20 is the max which we introduce. Now we will observe the video of calibration, but before that it's very important to know that when we are able to introduce an 18 French catheter with ease without resistance, that means we have achieved the normal caliber of urethra. That is the normal caliber of urethra for an adult, and that's why we go for just one extra size 20 French to make sure that this spongiofibrosis is completely removed or addressed. Now, when a urologist perform any procedure, maybe dilatation or any surgery to open up the stricture like DVIU, generally they open it up to at least 22 French size, routinely 24, 26, 28, 30, 32 even. Why that big? Because they know that very soon it is going to get constricted again. So, to open up a stricture is not a big job, it is a very small thing. But to maintain the caliber afterwards is the main challenge, and this is what we are doing with this particular treatment. And most of our patients after the treatment of Uttarbasti and the calibration, they are leading absolutely normal life since years. So first of all we will observe the video of calibration, how the calibration is performed. So here, like the way it is showed, that we introduce some anesthetic gel into the urethra, which gives some numbness, at the same time lubrication. Now for this patient in this demonstration, this is the last calibration, and in this we are going to introduce a 20 French Narayan catheter which is disposable. So this is a disposable Narayan catheter, which is kind of polycath material, which is soft. I am dipping the catheter in the Uttarbasti oil for extra lubrication. This is very important that while introducing the catheter, it has to be introduced very gently. Again, this procedure is also absolutely painless. We did perform calibrations for kids as well, so it is painless. While introducing the catheter, it should be very important that it has to be introduced as gently as possible with due respect to the nature of urethra without causing a new injury. And not only while introducing, but even while removing the catheter, it has to be very gentle. And as you can see that there is not even little blood stain on the catheter. Forget about the bleeding, but not even little blood stain. So this is the most important part or beauty of this treatment, that we are opening up the stricture, the urethral stricture, without causing a new injury. The way we discussed in our last video, that the main reason behind the stricture formation is a wound or injury inside urethra. And whenever they perform either dilatation or any surgery, a new wound is formed again and the pathology restarts. So in this particular treatment, we are going to break that vicious cycle of pathology, and that's why most of our patients are leading absolutely normal life, and this particular treatment is proving to be the most promising treatment for urethral stricture disease. Now, one more interesting fact regarding this is that the medicines used during initial 5 settings makes this spongiofibrosis so soft that we are able to introduce catheters up to 20 French on 6th day only. Now obviously it's very important that when we introduce catheter of bigger size, we introduce it only after confirming that when we are able to introduce the catheter 12 French very easily, then and then only we will introduce a 14 French catheter. If it goes in easily, without pain, without bleeding, without an injury to the urethra, then and then we go for the 16 French, then 18 French and then the 20 French. So why we do this? in normal course generally we go for 4 calibrations. Again, this is not a normal thing. So, we always try to reduce the manipulation, we always try to reduce the number of calibrations. So, if we are able to introduce catheters up to 20 French on 6th day only, so in that case we are not going for 4 calibrations, instead we may go for 3 or maybe even 2 calibrations. So, we always try to reduce the number of calibrations. So, next thing is, before commencement of the treatment we go for one uroflowmetry. And we repeat the uroflowmetry on 14th day. So that we will come to know that where we were and where we are now. Actually, patient is able to observe a significant improvement in the flow of urine from 6th day onwards only. But we go for the uroflowmetry on 14th day. Then from 13th day onwards up to 20th day, only Uttarbasti. Then there is no need to introduce a catheter, because that part, calibration part, is over, and these 4 treatments are called as calibration of urethra. So, with this treatment definitely we are able to restore the caliber and at the same time the elasticity, the softness of urethra. So, by now it is very clear that unless and until this hardness is completely resolved, all the softness is completely restored, urethral stricture disease cannot be cured. So, again it is very clear that for most of the patients we observe that during this course of 20 days this fibrosis is completely removed, the softness is restored. But yes, for few patients whose fibrosis is very rigid, in that case it is not completely removed or it is not completely made soft back to its normal state. And how it is observed or come to know to us, when we introduce a catheter, especially during the last calibration, when we introduce a catheter, the catheter enters and goes in very smooth, and as soon as it approaches the area where that rigidity still persists, there is little obstruction felt. Exactly the way when a vehicle is moving and when that vehicle moves along or across a speed breaker, a little jerk is observed or little resistance is observed, turbulence is observed. Exactly same way, when we introduce a catheter that enters up to the level of that fibrosis easily, as soon as it goes there, a little obstruction is felt. So, that should not be there. So, if in case it is observed, in that case obviously we need to address that as well, because unless and until that urethra, that fibrosis is completely removed or it is restored back to its normal softness, it cannot be cured. So, in that case, for that patient only, we advise 10 ml syringes which are pre-filled with medicines. So, those medicines are given to that patient. Obviously, before the completion of the treatment, before the discharge, we treat that patient how to use those syringes. That patient has to introduce that medicine into urethra at bedtime every single night for 90 days. Now, what is the purpose of this? So, when that patient is introducing that medicine every single day, that definitely is very easier as compared to the self catheterization. It is very easy. Introduction of that medicine, just that patient, it is very easy, we teach that patient whenever it is necessary. So, by introducing that medicine into urethra every single night, that medicine goes inside urethra, it paints the whole urethral lining, especially the area where that fibrosis or stiffness is still persists. So, it is painting that area every single night for 90 days, and during that course obviously gradually that hardness goes off completely and the softness is completely restored. So, the main aim is we are fighting with this disease since last 22 years. We have to cure the disease at any cost. So, that is the purpose. Now, as we very well know that it is very well mentioned in the textbook of urology that once a stricture, always a stricture. So, with this nature, with due respect of the nature of the disease, it's our responsibility that we should keep a close eye on the condition of that patient, and for that follow-ups are very important for us. So, the follow-ups. First follow up after 3 months. Now, why this follow up is important? The patients who are in need of syringes, for them there is compulsory or mandatory follow up treatment of 7 days. They have to come for the treatment for 7 days. In those 7 days, what we do? 3 days Uttarbasti, on 4th day we do calibration, and in this calibration we check whether that softness is completely restored or not. In most of the patients, that softness is completely restored and the fibrosis is completely removed within the 90 days period. Yes, very rarely we observe that still that rigidity persists. So, in that case we may provide few more syringes to that patient and 3 more days of Uttarbasti. So, it is a total 7 days treatment, 3 Uttarbasti, 4 day calibration and 3 Uttarbasti. Now, the patients whose softness is completely restored during 20 days, for them the syringes are not mandatory and they need not to come for follow up treatment as well. So, what they have to do? Just go for one uroflowmetry and share the uroflowmetry to us. No need to come to Brahma Ayurveda. Now, the second follow up. The second follow up is after 9 months of the last day of the treatment, 9 months. Now, here again there is no need to come to Brahma Ayurveda, just need to go for an uroflowmetry. We need to observe how the flow goes on. So, one has to go for one uroflowmetry and share that uroflowmetry with us, that is it. Then the third follow up. Third follow up will be after 1 year and 9 months. That is the last follow up. So, we need to keep a close watch or eye on the condition for almost 1 year and 9 months after the treatment, and this is very important for us. Now, to be honest, as per our experience of last 22 days and the way we are analyzing the data for patients of last 22 years, more than 87% patients, they are leading absolutely normal life after a course of 20 days treatment. Once they are treated with 20 days course, since years they are leading absolutely normal life. Yes, for less than 13% patients, they needed follow up treatments. So, obviously those are definitely complicated cases. We have patients who underwent multiple surgeries on urethra, like multiple DVIUs, multiple dilatations. There are patients who like were doing CISC or self catheterization since years every single day. We have patients who underwent urethroplasties twice, and even like after that much complications, though such patients needed to follow, but still they are leading normal life after few follow ups. So, this is the fact. So, the most important part about this treatment is, like, we haven't observed any specific side effect or ill effect of this treatment or these medicines. Yes, multiple surgeries like VIU, DVIU or urethroplasty may affect the sexual life of that person, but as far as Uttarbasti treatment is concerned, definitely it never affects the sexual life. In fact, many of our patients have given the feedback that after this particular treatment for urethral stricture disease, they have observed significant improvement in their sexual life. So, this is again a best part of this. Second part, like we have seen, like we have treated many young boys for this disease, and now they are married, they are happily married, they are leading absolutely normal married life, they have kids as well. So, that way again this is absolutely safe. Now, as far as the complications are concerned of this treatment, yes, there are like there is a very minor risk which is of infection, because when a person suffers with urethral stricture disease, there is a raw area inside urethra. So, that person may catch infection at any point of time. But in our routine, what we have observed, that the medicines which we are using for Uttarbasti and the oral medicine at the same time, they are taking care of the infection. So, very rarely we need to use an antibiotic. So, we hardly use an antibiotic in our routine course. So, the oral Ayurvedic medicines and the Uttarbasti medicines, they themselves take care of the infection, they prevent the infection, they manage the infection as well. We also regularly manage recurrent urinary tract infection in our routine. So, this is the fact. And few more things regarding the treatment, that as I mentioned earlier, that we are practicing in the field since more than 2 decades. It's been more than 22 years now, and fortunately, by God's grace, fortunately, with the strength of Ayurveda, most of our patients, they are leading absolutely normal life after this treatment. This is the best part, and that's why I always say that this is proving to be the most promising treatment for urethral stricture disease. Now, one more fact about this, that the treatment of Ayurveda is always in 2 parts. The first part is specific disease treatment. In Ayurveda, we call this as Vyadhi Vishesh Chikitsa, specific disease treatment. So, this is the specific disease treatment which we address during these 20 days. And the second part is Apunarbhav Chikitsa, means treatment to prevent the recurrence. In that, for each and every patient, there is a course of almost course of oral medication for 3 months. Now, these medicines are also very specific. So, collectively the treatment of Uttarbasti and the oral medicines, they help to remove the spongiofibrosis, that too gradually without causing a new injury to urethra. Second, they helped to regenerate the inner skin of the bladder and urethra, which is called as urothelium, means urothelial regeneration is there. So, that inner lining, inner skin of the bladder and urethra is completely healed with all these medicines. So, that wound is completely healed. At the same time, the elasticity of urethral and paraurethral tissue is improved, and the immunity of local tissue is also boosted. So, this is how the treatment of Uttarbasti helps to cure the urethral stricture disease, and that's why it is proving to be the most promising treatment for urethral stricture disease. I think this video must have helped you to understand the way Uttarbasti helps to cure the urethral stricture disease. Thank you. Take care.